Just want to say welcome to the first folks who have joined. We'll be getting started here in about 3 or 4 minutes. Good morning, good afternoon to those who are just joining. If you're looking for the Community Engagement Forum, you're in the right place. We'll get started here in a couple more minutes. Thanks for being with us. All right, well, I think I'm going to go ahead and get us started. Jordan, if you can take down the rotating slides. Thanks for that. I'm Don Nease. I am director of our Community Engagement and Research Core with CCTSI, and I'm happy to welcome you all to today's Community Engagement Forum. Today, we're going to continue our series on ethical data practices, and we'll be talking about from storage to sovereignty. And again, this is part of our larger series, engaging the community in data analysis and interpretation. Um, just a brief plug for coming events. In April, for the past couple of years, and again this year, we'll be having our in-person forum and networking session, and that's going to happen on April 24th. Encourage you to mark your calendars for that. we're very excited to welcome Dr. Nina Wallerstein from the University of New Mexico, who will be our plenary speaker for that event. Dr. Wallerstein has authored many, many publications on community-based participatory research and is a great speaker on that topic, and we're excited to have her join us. Um, I'm going to do some introductory comments today, and then after that, we'll be passing the baton to Dr. Susan Moore. Um, Susan is a very valued colleague of mine. She directs the mHealth Impact Lab. She's an associate professor in the Department of Community and Behavioral Health in our School of Public Health, and also directs the Digital Health Technology Core in the Adult and Child Center for Outcomes Research and Delivery Science. Um, Susan is somebody who knows the value of engaging with patients and communities deeply, and I'm excited to hear her comments today. So with that, I'm going to go ahead and dive into our sort of setting the stage comments here. Let me share my screen and I will pull up my slides. And want to give credit to my partner, Dr. Sarah Brewer, who is also at Accords. Sarah did the lion's share of work on these slides, and but was unable to be here today due to a competing event in Washington, D.C. So I'm happy to present these for you today. So to set the stage for Dr. Moore's presentation, we're going to talk a little bit about the spectrum of engagement to engage community partners in data analysis. And I just want to encourage folks all during this hour, please make use of the chat if you've got questions. We would love to hear those, and comments as well are welcome. So, data analysis. I think typically in the research world, we kind of think about that as our space, the researcher's role. This is kind of where our specialized skills and training can shine. There's all kinds of geeky software out there that we can use, and sometimes that's pretty expensive. It's a place where we like to use our expertise, and it's kind of the default mode. Uh, but I want to encourage us to think about how we can engage our community partners today, and that there's a really a spectrum, just like in much other aspects of community engaged research around which we can engage folks. A lot of analysis is around, we have to make decisions about how we're going to analyze the data, what sorts of questions we're going to ask of the data. And that's definitely a place where community can be at the table and part of the discussion. Even the software these days is getting more accessible, more affordable. There's open source stuff out there. And so expertise also is not just degrees and training. The lived experience of folks in the community with the topic can be really valuable in helping us to understand what the data means. So to set the stage here, I'm just going to encourage us to think that doesn't always have to be totally on the researchers to be active in this space of data analysis. And I think in previous forums, we've often presented that there's a spectrum of engagement, and there's a lot of different models, many of which are quite similar out there that you can use. We've often used this IAP2 spectrum to talk about it, that goes from inform through consult, involve, collaborate, all the way to empower. And we're going to kind of walk through this model. And just some things to keep in mind as we're walking through this. The right engagement could be really in any of these columns, depending on what the project is, depending on the partnership, depending on your goals. And it's important to be intentional and transparent about which of these lanes you're really in when you're working with community. And that's to say also that it could change over the course of a partnership or project. But early on, I want to encourage all of us to think about having these conversations up front. So let's just walk our way through this model. So informing, this is kind of the usual, what we fall back on, very traditional research approach. We do all the analysis, most of the interpretation, and we share those with the public or our community partners several different ways. It's usually pretty one directional, might involve sharing an analysis plan or notifying partners, and key being notifying partners of preliminary or final results. And, this just flows into publications, conference presentations, maybe some presentations in the community. But again, it's all coming from the academic side. As we start to move, though, to the right to consult, this is where we start to begin to involve our partners. So here you could be asking for input about analysis plans or steps. And, just as a reminder, the best analysis plans are done when you're conceiving of the project. So, you can start this early on. But again, here in the consultation model, we're crunching the numbers, may even be doing a lot of the interpretation of those. We might bring some targeted questions for partner input. We might share a draft analysis plan, and we might present near final results for some tweaking by the community. But again, it's still largely in this consultative role. As we get to involve, then we're asking for more input. Again, could be around analysis plans and steps. Here, the information flows start to go in both directions, but still typically led by the academics. Again, examples would be input on general and specific questions for planning and conducting an analysis, drafting that analysis plan together, getting feedback perhaps from community partners, and then presenting results at several points and making adjustments based on input. Again, best analysis plans are always done before you get into the actually doing the project, but we all know those evolve over time. So kind of revisiting those can be really helpful to involve community members, your community partners, when you're doing that. As we get to the collaborate stage, here we're really, I kind of think of this as a co-creation model. So we're working together, hand in hand, to develop those analysis plans. And again, I think about that as what questions do we want to ask of the data? Conducting that analysis together really in a very iterative fashion that brings out the best skills and strengths of both partners. So again, examples, putting that analysis plan together in partnership. Everybody is involved, very hands-on, presenting preliminary results at several points, and again, making adjustments. And really, what do the results mean? This is where I think getting that lived experience, getting that on the ground knowledge of our community partners can be so important. Lastly, when we get all the way to the right side, this is where community partners are really leading the process. And I think this is probably where our community partners may have come to us with a question about a particular issue that they see being manifested in their community. And so we develop the analysis plans, conduct the analysis together, but really community is leading this because they know what questions they want to get answered. Information flow, again, in both directions, but primary leadership by community partners. Community partners are going to have the bulk of input into deciding on what the questions are, drafting the analysis plans, maybe much more involved and hands-on with data and analytics steps. And they may take the lead on presenting preliminary results, getting our input, and as things then for interpretation, definitely leading that step. And this is where, when things are disseminated, whether it's back to the community or in academic circles, it's often great to have community members lead. So again, to get back to where I started, it's really about thinking intentionally about your partnership and your goals. What level are you seeking to have? What makes sense? There's not a right or wrong answer here in general, but there's probably a right answer for your partnership and what you want to accomplish. What are the skills and capacities that each partner has? How can you use this to build capacity and build new skills? And think about what are the opportunities to maybe stretch a little bit to the right outside your comfort zone on the data analysis rather than just defaulting to that informed level. So with that, oops, my slides are jumping around here. With that, I'm going to stop sharing and I am going to pass the baton to Dr. Moore.
Good morning, afternoon. Good afternoon, everybody. Thank you so much for being here. I really appreciate it. Thank you to the entire Community Engagement Forum team for giving me the chance to share some thoughts on this. I will do my best to match my presentation to the framework that's laid out as we go through this. I apologize in advance if my network decides to be problematic. It is apparently a difficult internet day over here on this side of the campus, but all of these slides will be available later for anybody, if anybody misses anything. There'll be a follow-up for questions, and we've got lots of time left for discussion as well, which I think is going to be really important because the intent of this part of the conversation is to introduce, to build on the spectrum and introduce some projects and specific examples and ways that even in what might be considered non-community engaged research, I hope to convince you that all research can, in different ways, be community engaged research. I'm going to talk about a particular type and approach to that and give a couple of different project examples to show that in practicality. So we'll go through three things in this section of the conversation. I'll give a brief overview of something that's called mixed methods research as a sort of an orientation for how community partners can be engaged in research even across the spectrum in different ways. I'm going to touch on, just as a reminder, I'm sure that everybody here knows, but I'm going to touch on some central principles for collaborating with community members, no matter the role, no matter where you are on the spectrum. Some of the things that continue to persist and should persist. And then I'm going to finish with a brief discussion of 3 real-world project experiences and share some of the community-focused insights that came from each of those. Don already introduced me, so I'm not going to spend time on this, but one thing I want to highlight is that the through line in all of the projects that I'm going to be talking about is the use of technology in different types of projects. So you'll see a variety of different things there, but technology is the common thread. So first thing, just as an orientation process here, what is mixed methods research in particular? And what that is the thoughtful and structured combination of different information from different sources to give a more complete and comprehensive picture in the research that you're doing. So we're primarily talking about 2 broad buckets of information types. Quantitative data, which most people think of as the numbers-based and associate it with statistics and statistical analyses. This is the more deductive reasoning where you're drawing conclusions from the data that's being analyzed and interpreted. And it allows you to do inferential conclusions about causality using quantitative data. Qualitative data, as we're familiar with, is more inductive and allows you to do exploration of new concepts, emerging ideas, to find new things that might emerge in conversations or review of information and lead in new directions for exploration. It also gives you some insight into contextual factors. And qualitative data can be particularly important in that it gives a very rich picture of the data, where quantitative data gives you a broader, a broader overview of information. Mixing the two together in a structured fashion, and this is something more than just collecting both of these different types of data and having to report on them. It's where that's what's called multiple methods research. The intentional combination of the data from the sources in the analysis component and in the interpretation component is central to this idea. And I find that mixed methods research is an excellent way to engage community partners in research projects, even if the research itself was not necessarily originally envisioned as community engaged research. So just to highlight super quick, I'm going to talk about a few different design choices for mixed methods. There's choices that you make along the way, starting with whether or not you're doing the work in sequence or you're doing it concurrently at the same time, whether you're looking to explain things or whether you're looking to explore new things, and whether you are nesting or embedding one piece of the data collection for the analysis inside the other as a smaller component of it, or they're approximately equal and non-nested. So this is just to go through a couple of different examinations of how that can play out in practice. This is what an exploratory sequential design might look like if you are trying to figure out how to create a new intervention or a new solution or some new idea. You might start with collecting qualitative data, like through interviews or focus groups or community listening sessions, and engaging community partners in that qualitative work up front to inform and create what comes after that in terms of the quantitative data collection, where you might implement a health indicator measures intervention and be tracking things through a large survey, something along those lines. An explanatory sequential design is basically the reverse of these two, where instead of starting with the qualitative exploration, you start with the big picture through the quantitative data. And then you attempt to understand it in the analysis and interpretation by looking for deeper insights through the qualitative methods. This is a really particularly good design for community partner engagement and work if you're trying to figure out why something might have been applied in a certain way, or why a certain behavioral pattern or certain health trends are being seen among the community. Exploring and digging into that in partnership with community through qualitative approaches is a really good way to inform that data interpretation. Convergent parallel is where basically you collect both at the same time, and then you compare the results from each together at once to see if you can understand better what you're seeing in, say, the quantitative data from the insights informed by the qualitative data. And then an example of an embedded concurrent design is where you might start with a bigger project, collecting quantitative numbers-based data, and then do as a subset of that information, focus on exploring more deeply with some qualitative work, and then again lead to combined and compared results. I am showing these designs for a reason, because the projects that I'm talking about, I used different designs. I mentioned that we'd talk about some true north type of principles for community engagement, no matter where on that spectrum, or no matter what. And this is even more important when you're coming to data analysis and data interpretation in combination with community partners. One thing that I insist all of my research investigator partners remember when we're engaging with community partners is that community members are experts. their own people's own lived experiences, people's own backgrounds, the things that they are going through or that they are seeing or that they are bringing to the table. They might be different perspectives than traditional research methods or traditional research expectations, or they might use different terminology than what researchers are taught to use. That doesn't mean it's any less important. That doesn't mean it's any less expert. And that doesn't mean it's that one is more valid than the other. So it's really important when you're working with community partners in data analysis and interpretation, or in general, to avoid stigmatization and to avoid unconsciously lessening the weight given to community partner perspectives in the interpretation of the information, because they're experts too. Clear communication is absolutely essential. Researchers tend to have a common terminology that we're all taught to use through perhaps entirely too many years of school. And we all have generally a common understanding of some of those terms of practice. Those don't necessarily mean the same thing when you're working with community partners, so you can't assume in a good partnership that anything means the same thing to all parties involved. At the same time, it's also important to remember that community partners and researchers may have different expectations for what's coming out of a research project. They may have different needs and they may have different goals. Being right up front at the very beginning of a collaboration and all the way throughout to the very end and beyond, and touching base and being very clear about those expectations and those hopes and those understandings and the definitions of things is absolutely critical to doing good work together and to really getting the most out of the data in the analysis and interpretation phase. And finally, one thing that's particularly important around interpretation of data is to share the results. A lot of times you'll see research partners, researchers, investigators will be so excited to finish their project and they publish the results in a peer-reviewed publication and everybody's very happy about it. That's not enough, especially when you're working with community members. You have to pay attention and make sure that information is shared back, both in traditional channels like those peer-reviewed publications, but also other channels, whether it be reporting in podcasts or preparing community-specific summaries or meeting with people to explain and review. All of these things are absolutely key. So I'm going to go through 3 different projects at a very high level. Encourage people to ask me questions about anything that you want to know more about in our open discussion time. First is I'm going to talk about a text messaging project looking at management of diabetes for patients with diabetes. Then I'm going to look at a remote patient monitoring project for patients after bone marrow transplant. And finally, a more traditional community engagement approach around creating an infrastructure to support direct patient engagement across a number of projects at Denver Health. So this first project, the Care by Cell Phone, this is an example of an embedded concurrent design where we did the big picture project and then we dug in with a subset of people to explore things through that qualitative data. 47 patients living with diabetes received and answered text messages to share their blood sugar information over 3 months in time. And then while that was going on, we dug in through focus group conversations with people in English and Spanish to ask for their perspectives on the project, ask for their perspectives on this work and on what we were finding as we shared that back. And this is important because the insights from those participants and from all of the patients who were engaged in the study helped us learn a lot about the system and helped us improve it over time. So as an example for the text messages, it was a bidirectional closed loop messaging. So we would send a request, they would send a response, we would send a thank you. And what we found is that people started talking to the system through text message as though they were talking directly to their provider or they were talking to friends. We had people share with us that, their blood sugar might not be good today because they had a birthday celebration with family members the night before, and so they had eaten more cake than they expected to. We had people letting us know that they really liked getting the thank yous because it made them feel more cared about, which helped us know in turn that anything that we did in the future had to have that closed loop component so that we could make sure that people continued to feel connected to the health system. We found out in the conversations that people showed up to the focus group discussions and they brought friends and family members to try to get them signed up for the program. And we had people show up who showed us how they kept the messages on their phone to share with other members of the community so that they were able to share the information far beyond what we had expected. And that they were able, younger people were able to use the messages as leverage to have conversations with their parents about medical conditions and chronic disease management because the information was coming from the health system. All of these insights from patients and community members helped us know what the needs actually in the community were beyond traditional diabetes management programs and helped us adapt our outreach approach so that we were better able to work with them on what made things easier for them. The second project is a remote patient monitoring project. This is for working with a small startup company that was interested in finding ways to offer technology-based support for people after they get CAR T-cell therapy or after they get bone marrow transplant. And then instead of staying in the hospital for weeks and months while they recover, so that they could go home and recover in the comfort of their own home with wearing a device and texting with a chatbot to let their providers know how they were doing on a daily basis. So people wore things around the clock. Virtual care center personnel stayed in touch. People gave us patients, caregivers, and healthcare providers shared surveys about their experience with and perceptions of the program. We worked with the startup company on the design of the research and on the types of things that they really needed to know in order to find the best way to help people. So this on the spectrum would be an example of involvement, where the first project would be an example more of the consultation level. And what we found in conversations with patients, caregivers, and providers is that the solution was working pretty well. They gave us some specific examples of areas that we could improve. And we let the startup know that, and we improved that in the care that we were providing as well. The study actually shaped very directly. We found that caregivers, patients were kind of okay with it, but the caregivers felt that they were getting a lot more support for their patients that they were working with, and they were really glad to have that connection in between projects. So that ended up being really helpful and informed the development of the program overall. And so the startup company has gone off and taken this across the nation for more people based on the insights that were provided by the patients here in this particular project. And then finally, because I'm keeping an eye on the clock and I want to make sure that we're leaving plenty of time for conversation, the last initiative is much more at the collaborate level of the community engagement spectrum that Don presented on earlier. And this was an initiative at Denver Health, originally led by Ed Havernack, and it was a multifaceted initiative with multiple funding sources. One was the Agency for Healthcare Research and Quality. One was PCORI, and particularly their Eugene Washington Patient Engagement Program. And what this had was two really central elements to systematically work with community members and community partners to not only for them to learn about research and analysis and how to interpret results and share that information back with other members of their communities, but also to empower them and to advise actively on research projects that were proposed by investigators within the institution that they were hoping to do better with community partner insight. So we created a standing community advisory panel with the help of Charlene Ortiz as a facilitator to help us find people to participate on this as a standing panel. And that panel also turned into a Colorado Patient Partners and Research Council that was doing advisory work with Denver Health and with Kaiser Permanente. And investigators at Denver Health who are interested in doing projects would bring formal presentations to panel meetings and share what they were proposing and receive pretty pointed questions and feedback and advice on how to conduct their work, on the types of questions that they should be asking, and on how to interpret it at the end, and to think about how to share the results out with community members, with the patients who participated in the study, and with community members more broadly than that. So an investigator who brought a project would not just bring an idea and then run off again. They came back at the end of their project as well to share that back to the panel. Another thing that spun out of this work was creating the COPPER network for Colorado Patient Partners in Research. And this was a web-based resource to match investigators with projects with patients who were interested in being community partners and advisors on those projects. It was advised actively by this standing panel and included a social media campaign. It was 2017 when we first did this work, so we used Twitter and Facebook, and 500 patient partners signed up and 13 joined projects within the first 6 months to continue to engage going forward. So that is a quick overview of things, because I think I am probably running close to out of time, just looking at the schedule here. And so I will stop there to make sure that we're giving people plenty of opportunities for questions and thoughts.
All right. Thanks, Susan. That was great. Nice to see you mentioning the Copper Project. One of our community research liaisons, Leslie Wright, was also very involved in that, along with Charlene. So, yeah.
Yes. Leslie gave some fabulous insights too, and was pretty pointed in some of the questions brought to the table, which was
Yeah.
really helpful to people.
Right, right. Looks like Daniel has a question in the chat about RPM. Are you planning to increase the number of participants? Yeah.
That's a great question. This particular project was very specifically done with a small number of patients at the start, so that we could, and I should have said this, so thank you for asking this question, so that we could learn any adaptations and changes that needed to be made before bringing it to a larger number of patients. So the intent is to bring it to a bigger study, or even potentially roll it out within the health system so that it would be available for all patients going forward. So a very small size for the original idea. I think we had 10 patients total, but that was able to give us some key insights that were then used to inform not only the follow-up research, but the program as the startup company is now offering across the nation, and based on what they learned from partnering and the feedback that they got here.
All right. And then we have a question from Paul, who first says thanks for the important information, and then asks about guidelines for appropriate community partner compensation.
Oh, that's such a great question. Yes and no. So the guidelines are a little bit of a rule of thumb, rather than having anything structured written down, because we also, what I recommend to people is that we also have to try to be flexible with community partners on the types of compensation they want to accept, or what they want to do with it, so that we are conscious of their needs and wants and desires in the process. At the same time, it is essential to recognize that community partners who are bringing their expertise, they are doing work, and work deserves to be compensated. It is not fair to community partners to ask this to be volunteer work. So I usually recommend that the researchers look at their own hourly salaries and use that as a rule of thumb, and take that, your own salary and what it is with a benefit rate on top of that. Researchers are used to doing all that kind of thing for all the budgets that we do with all of our different grant proposals and funding applications, and try to come up with an approximation of what, if you know what an hour of your time is, then why should your community partner be any less than that? So at the same time, there are sometimes also guidelines from funding agencies on what an acceptable, quote unquote, acceptable consultant rate is. And I think that the last time that I saw any official guidance on this, it was $100 an hour was the maximum that was allowed. So absolute back of the envelope rule of thumb, I would never go lower than $25 an hour, and I would aim for 50 as a good median type of thing.
Yeah, and I put in the chat a link to Pecori's compensation framework.
Thank you.
It's super helpful. Just, it kind of gets to why Susan said you can't have a hard and fast rule. There's a lot of things to think about, and that Pecori resource helps you kind of keep all those in mind. Jeanette also mentions important to think about travel and lodging compensation, also really important. Demai, hopefully I'm getting your name right, has a question about IRB. Have you found it easier or harder to utilize community IRBs versus our university ones?
Ooh, great question. I have found that it can vary by the project. Our university ones can, if they are well informed about community engaged research, can sometimes help facilitate. I have found that working with commercial IRBs that do really, every paper and every form has a different fee associated with it, and you see a lot of that in industry type of partner work, can be easy but expensive. And I have found that less informed IRBs sometimes struggle with the volume of what it takes. So I think just really planning that out and carefully at the beginning of a project is your best bet.
Yeah, great. Antonio has a question. As a community member, my question is, how does mixed methods research compare with CBPR, community-based participatory research?
Really, really great question. So mixed methods research is on the spectrum of research types, I guess. You could do CBPR that has a mixed methods component, with the idea is that you're doing community-based participatory research with community members as active participants and members of the research team. And you can collect information and data in both those quantitative and qualitative ways, and thoughtfully combine those results together. So not all CBPR, not all mixed methods research is CBPR, not all CBPR is mixed methods research, but you can incorporate the one into the other. I hope that makes sense. If not, say so, and I'll try to clarify.
Yeah, thanks, Susan. Next question is from Lynn, who asks about basic inclusion or exclusion criteria in selecting community partners.
Ooh. I think, and just sort of based on previous selections and previous partnerships, it depends some on the goal of the project. It depends some on the community that is being served by the project. So looking at the second example study that I was talking about, working with patients and caregivers and providers for patients living with who've just had a bone marrow transplant or something like that, it would not necessarily do the team much good to be talking to people who don't have that sort of lived experience with cancer and with bone marrow transplant. So in that case, the community is much more informed by the type of condition. But if you're also thinking bigger picture or more population affecting things or something that's more generalizable or more likely to affect people across all different types of communities, then I think that the more that you can do with ensuring that a diversity of perspectives and experiences are represented. And like in the community advisory panel that we were talking about, we definitely sought voices from a number of different communities so that no single perspective would dominate. So that we were trying in that case to be reflective of patients who receive care at Denver Health and make sure that all different types and communities of patients who receive care at Denver Health had their voice heard in that partnership.
Yeah, Susan, I couldn't agree more. I just also put a link to a paper that some of us authored a while back on the just right patient for research, which I think is pretty similar to some of the principles around engaging community members as partners.
And one other thing I will say on that is that uh, one thing that makes a really good partnership is that people who are interested in and willing to be participants make really good partners. Like if I had a choice among people and somebody was very interested in learning about research or being part of research or helping to uh, frame and shape the way research would go versus somebody who was very distrustful of research and wanted to be involved only to tear it down, that person might be less of a partner and more of somebody with a different reason for being there versus the first person.
All right. Any other questions? And happy to also hear from folks who've had experience doing this kind of work, either on the community or the academic side.
And echoing Don, if there's anybody in the room who has their own experiences that they want to share.
Well, I will share just one quick thing. So the academic researchers in our community academic partnership did publish a number of articles. But what we as community have done is we are reaching so many people in the community with our work with infants. Sunday, during the storm and the Bronco game, I had 22 families who are expecting their first baby show up to learn how to talk and enrich the language development of those babies. And every time we can bring the very community families who had no understanding of the work that we were introducing to them, they are our presenters. When we go to conferences now and we have 100 to 200 people, those families are the ones that present, and you can imagine the buy-in from the community. I believe why they are in that position now is simply the confidence that they had worked with academic researchers who respected their work. And I don't think before that meeting and that coming together that these young women would ever have, or men would have ever felt comfortable going before so many people to present what they had learned.
That is so exciting to hear about that kind of success and that kind of sharing. And you are, of course, absolutely right that sort of it's what I said before. Community members are experts too, but also having that capacity building for community partners so that they can feel more empowered to share out the results and to speak out and to engage as on equal ground with researchers. It's just so fabulous to hear, and that's
totally validates that lived experience. Yeah.
Thanks, Marianne. Anybody else? Faith has a question. What suggestions or recommendations do you have for a doctoral student who's interested in doing this type of research as part of a dissertation?
I think that first, feel encouraged to do it because this is important work that continues to be important work. So I'm excited to hear that. I think also take advantage of resources like the CCTSI Community Engagement Corps and the Accords Community Engagement Group to help find more senior faculty members who can help oversee that and who have some connections to help bring you to projects and to things for your dissertation to help you make those connections, because people who have been doing this work for a while can sometimes help you make connections and either on existing projects or with existing community partners to help facilitate that kind of dissertation work. And if none of that works for you, reach out to me directly and we'll talk through what you've got in mind and I'll help you find the right person to work with.
And looks like Mary beat me to the punch on our immersion training and community engagement through CCTSI. So yeah, just a reminder about that program, which will be taking applications next month, very soon.
I'll add one more comment. This is Jeanette. I'm staying off camera because I'm very, very ill right now with the flu. But I'll say community partners are amazing and sometimes have more expertise than you do on a particular research subject. And that's what I've been finding working with the group I run called CARES, which is Community Advisors for Research Equity in Science, and they are cancer survivors and family members and advocates. And they have been not only great with helping researchers find advisors for their community panel, for their community, the community advisors they may need for, say, their PCORI grants or something like that, but just connecting patients around the country and getting patients to events at the cancer center. So not only it's not like a one-time thing with my community engaged group. We do pay them well, and we do listen to them. We actually uh, value their input and have changed direction in our group several times about what we're covering in terms of research topics. And yeah, I can't say the time you put in to establish those relationships is so important, and you could reap benefits you would not even imagine. So I just want to say a shout out to this kind of work that you're doing, Susan and Don and Mary.
Thanks, Jeanette. Thanks,
I
Mary,
see
for
that Mary has linked to the CARES program in chat, I think.
yeah,
Thank you, Mary.
that's great. Susan, just a question for me.
Yeah.
Have you ever had an experience where um, your community partner totally changed the way you were thinking about an analysis or um, the results? Yeah.
Yeah. The answer is yes. And I'm being a little circumspect about it because the one that immediately came to mind was a project that was sponsored by an industry partner,
Hmm.
and they're still building the they're still building the solution that's coming out of it. So I can't actually talk about what it is in any great level of detail. But in this particular case, we were talking with community members who also happen to be patients and trying to get their perspective on what they thought might be what this proposed solution was. And we were like, we want to do this and we want to share this type of information and we want to share it in this way. And that's as far as I got before the community partner said, yeah, that's complete bullcrap. Nobody needs that. Nobody wants it. And how you're proposing to share it is not a way that anybody is going to use it. And I said, okay, wasn't what I was expecting to hear today, but thank you for letting me know. Can you tell me a little bit about why and what's wrong with it? And they're like, well, this particular thing that you're talking about building and that you want to bring out to this particular area, um, you know that nobody uses that there, right? Because they don't have internet. And you're talking about something that needs to be connected 100% of the time. And it's, this complex video, and nobody's got the time for that. And nobody's going to watch it in between what they're doing, on the farm. I was like, okay, all right, we're going to go back to the drawing board with this. Thank you. And so we started over with the plan for the solution.
Yeah. And just, I mean, hugely helpful to hear that kind of stuff early on.
Oh, you want to hear it before you get before you get all the way down the line. It is
Yeah.
so important to know that, and to reframe and to reshape and to pivot and redirect. I've seen, yeah, I've seen projects actually move in a different direction. I've seen one be canceled entirely because the need that the team thought was there was not there. And so that kind of feedback is invaluable.
Yeah. Yeah. No, that's great. All right. Well, we've got just a few more minutes left. I will encourage you to complete our evaluation today. We look at these, and it really doesn't take long at all to complete. But it's so helpful for us in our planning purposes. So I encourage you to do that. Jordan posted that in the chat, and thanks for that, Jordan. And we're really looking forward to seeing everybody in person in April. And that'll be a lot of fun, and it'll be great to have Nina Wallerstein with us. We'll have, as in the past, we'll feature tables with community academic partnerships that are working together, and that's always a treat too, to see all the great work that's going on. All right. Well, I think with that, we'll give folks about 3 minutes back. And thanks everybody for joining us today. And enjoy the rest of your day.
Thank you, everybody.
Thanks, Susan.